Tonight, health officials across the U.S. are on high alert after the country's first reported measles death in a decade. It comes amid a growing number of cases reported today in Texas. CBS 8's Shannon Handy spoke with our local health experts about their concerns and the protocols in place here.
The child who died was unvaccinated and lived in Texas. San Diego health officials tell me there's no measles outbreak here, but with vaccination rates dropping, it's a possibility, which is why they've taken steps to prepare.
I think we have to be always concerned. One of the unique things about measles is that it's so highly contagious.
Dr. Edmund Milder is a pediatric infectious disease specialist at Rady Children's Hospital and UCSD Health. He says measles can spread so easily in part because it's airborne and can linger for hours.
Somebody with measles leaves the room and you come in a few hours later, you can still get it.
On top of that, someone infected may not know for weeks.
If you get exposed to measles today, you might get sick about 10 days later, but the range is even from 7 to 21 days.
Measles is a viral respiratory infection. Symptoms include high fever, runny nose, cough, red eyes, and a rash. In rare cases, it can lead to pneumonia and brain swelling. But measles is preventable with a vaccine. The protection rate is 99% with 2 doses. Before the MMR vaccine was introduced in 1963, 400 to 500 people died every year. The child who died in Texas is the first measles death since 2015.
As soon as you open the door with lower vaccine rates, measles will return.
According to the county, 93.7% of kindergarten-age children in San Diego are up to date on MMR vaccines for the current school year, a drop from the year before. The numbers for children under the age of 5 or even lower, estimated to be between 80 and 88%. 95% is the desired threshold for protection. Dr. Eric Berg is the county's assistant medical director for epidemiology and immunization services.
It's certainly something that we're constantly prepared for, to detect a measles case and to respond to it.
While there are no current measles cases in the county, last year there were 4 unrelated ones linked to people who traveled overseas. Dr. Berg says they were able to prevent a local outbreak thanks to the training they've done, including a simulated scenario involving a measles case.
We get all the stakeholders who would be a participant in a response to sit down and go through this exercise to see exactly how information will flow, expedite the process to make sure that we're doing things to the best of our abilities and do the best job we can in preventing secondary cases.
Shannon Handy, CBS 8.